Room scan. Ceiling. Check my ears. Okay. All right. Good morning. My name is Megan Marsh. I am a nurse practitioner student at Auburn University. Today I'll be performing an HEENT with musculoskeletal assessment. Today our patient is Janet. Good morning. I have already washed my hands and everything for the purposes of this assessment. And we are going to start with your name.
Janet,
And where are we at?
Tallahassee,
And what year is it?
2023.
Who's our president?
Joe Biden.
So patient is alert and oriented ×4. Her speech is clear and coherent. Patient ambulated in here with no abnormalities. Gait was normal. She appears to be in good health. Her skin is warm and dry, appropriate for ethnicity. We are going to check her nails. And before I go into that, her general appearance is she's dressed appropriate for the weather. There is no signs of distress. She is a adult female with no developmental abnormalities. Her posture is upright, slightly slouched, and her build is average, and she does not appear to be obese. And like I said, we checked her skin. It is warm, it's dry. We are going to look and inspect her nails. There is no clubbing of the fingernails. Cap refill is less than 3 seconds. Let's see her, and no tinting of the skin. There we go. And now we are going to move into her hair. It is evenly distributed throughout. It's coarse and thick. Her head does not appear to have any abnormalities or deformities. I'm just going to palpate any tenderness. No tenderness. No lumps or lesions. No lice. Her scalp is not flaky, and no sores to be seen. Now we're going to palpate the sinuses. Just let me know if you have any tenderness.
None.
Okay, and now we're going to percuss.
None.
All right, so no tenderness, no swelling in the maxillary or frontal sinuses. Now I'm going to have you raise your eyebrows and puff out your cheeks. Smile, frown, close your eyes. Try to open. All right, so cranial nerve 7 is intact. Now we are going to palpate the TMJ. Tell me if you feel any tenderness.
No.
No tenderness, no swelling, no edema. Now clench your cheeks. Perfect. And keep your eyes closed for me. I want you to tell me if you feel dull or sharp.
Dull. Sharp.
Okay.
Dull. Sharp.
All right, so that cranial nerve 5 is intact. Now I want you to keep your eyes closed and tell me what you smell.
Alcohol.
Okay, so that cranial nerve 1 is intact, her olfactory. Now we're going to go and to look in your, we're going to inspect your nose. It is symmetrical. We're going to palpate for any tenderness.
No.
No tenderness, good. Now can you hold one nostril and sniff? And the other side. Perfect. There is no occlusions. Nose is patent. Now we are gonna test. Let's see. We're gonna inspect the ears. No, I'm sorry. We are gonna palpate the lymph nodes. All right, so pre-auricular, post-auricular, occipital, anterior cervical, posterior cervical, submandibular, submental, tonsillar, and supraclavicular. Any tenderness?
No.
All right, so no swelling, no tenderness, lymph nodes are mobile and discrete. Now we are going to go into your eyes. We're going to look at your lids. There's no drooping of the eyelids. The sclera is white. Cornea is intact. Conjunctiva appears moist and pink with no abnormalities there. I'm going to palpate the lacrimal gland. Any tenderness?
No.
Perfect. No tenderness, no swelling. Now we're going to test her visual acuity. That would be cranial nerve 2. So I'm going to have you hold this about 14 inches from your face and read that last line there.
LTFPH.
All right, so vision is a 20/20 vision. That is cranial nerve 2. So now we're going to test her corneal light reflexes and make sure that there is reflection there. All right, so look straight ahead for me. All right, so there is direct light reflection visible slightly nasal to pupils. Now I'm going to have you cover one eye and uncover, and cover the other eye and uncover. All right, so there's no lateral movements of the covered eye when removed. So now we are going to go into cranial nerve 3. We're going to test her pupils. All right, so pupils are equal round reactive to light in about 3 millimeters. And there is a combination there. So now we're going to move into her ears. We're going to inspect and palpate for any tenderness or anything like that. Any tenderness?
No.
Okay. And now I'm going to just look inside the ears. Peanut up and back. All right. So there is a little bit of honey-colored cerumen in there. Tympanic membrane is pearly, shiny pearly gray, and the light seen at 5 o'clock. Now we are gonna test her hearing. I'm just gonna whisper something and then just respond of what you hear.
Go Tigers.
Perfect. Patient responds appropriately with no deficits. Now we are going to do cranial nerves 3, 4, and 6. So can you look ahead for me and follow my finger, okay? With just moving your eyes, not your head. Okay, so cranial nerves 3, 4, and 6 are intact. Can you cover your right eye, please? And tell me when you see my hand.
Now.
Okay. And cover your other eye.
Now.
All right, so that was the confrontation test. Visual fields are intact. Now let's go into With her hearing, we are gonna do the Weber and Renee test. So I'm gonna place this on the top of your head. Tell me if you hear it with both ears.
Yeah.
Okay. And now tell me when you don't hear it anymore.
Now.
Same thing.
Now.
All right, so air conduction is longer than bone conduction, so everything is intact there. Now we are going to move into the nose. It is symmetrical. We did palpate, there was no tenderness. Skin is dry, intact, no crusties or anything like that. I'm going to have you hold. We did the nostrils, didn't we? Okay. So now we are going to go, I'm going to look inside the nose and make sure there is no polyps or lesions, and make sure there's no deviated septum. We're doing both sides. So there is no polyps, no lesions, no deviated septum. Mucosa is red, a little clear drainage. Now let's look in your lips. Or look at your lips. There is no dryness. It's moist. Lips are moist. No cracking. No edema. And open your mouth for me. Mucosa is pink and moist. No ulcerations. I don't see any missing teeth or dental caries. Um, uh, can you open your mouth and say ah?
Ah.
Right. No cleft palate. And all right, good. So the stensons and sublingual ducts are visualized. Tongue is pink and moist. No lesions, redness, or swelling. And the palate rises with all. Now we're going to move into, let's see, now we're going to move into your neck. So we're just going to look, inspect, no scars, no lesions. Skin is dry. Everything is symmetrical. I'm going to palpate. Any tenderness?
No.
Okay. Now we are going to check and palpate the thyroid. Yeah, thank you. And go ahead and swallow for me. Perfect. Thyroid is palpated. It's normal. You can feel that when she swallows. Now we're going to check the carotids. And there is a strong carotid pulse there. Now we're going to move into cranial nerve 11. So shrug against me. Perfect. And then I'm going to push against your face. Just push against my hand. Perfect. Other side. Perfect. Head back. Forward. Ear to shoulder. To shoulder. Perfect. Cranial nerve 11 is intact. And then we are going to go into the musculoskeletal system. We just did her neck, full range of motion. Strength was 5 out of 5. We would palpate the inguinal lymph nodes and the femoral pulses, but for the purpose of this video and privacy, we will not do that. But they would be non-tender, mobile, and discrete, and the femoral pulses would be a 2+, as expected. Now we're going to inspect extremities, make sure there's no swelling or edema. Skin is dry, intact. Any tenderness?
No.
No. And then you would do both sides for the purpose of this, in the exam, but for the purpose of this video, we are only going to do one side. You would inspect and palpate all 4 extremities. We are going to go ahead and do your pulses. So radial and popliteal and dorsalis, postibial and the dorsalis pedis. All are 2+. You would check bilaterally for those pulses. Now we are going to check your range of motion. We already did your neck. Like we said, full range of motion, strength was 5 out of 5. We're going to check your shoulders now. So can you put your arms up and down behind you and above your head? Perfect. And shrug against me. All right. Strength is 5 out of 5, full range of motion in those shoulders. Now we are going to test your elbows. So up, go out, and rotate out, rotate in. Perfect. Up again, push against me, and pull. All right, so strength is 5 out of 5, full range of motion in those elbows. Now we're going to do your hands, wrists, and fingers. So spread your fingers and make a fist. Perfect. Rotate and grab. Perfect. Strength is 5 out of 5 in those hands, full range of motion in those hands and wrists. Now we are going to check your knees. Pushing against my hand. Perfect. We would do both sides. Strength is 5 out of 5. I'm going to have you put your leg up, back down, leg out, back, and we'll test your strength. We did, okay, 5 out of 5. So there's full range of motion in those knees, and strength is 5 out of 5. Now we are going to do your ankles. So leg out and then down, up, and rotate, and then push on my hand. Okay, perfect. So strength is 5 out of 5, full range of motion and the feet and ankles. Now we're going to go into your spine. So can you stand up for me? All right. And bend forward. Perfect. Now we're going to just palpate the spinal processes for any tenderness, check for scoliosis. There doesn't appear to be anything there, no tenderness in that spinal cavity. Now I'm going to have you bend back. Nope, this way. Perfect. And twist from your hips, each side, and then go side to side, other side, and perfect. So full range of motion in that spine. I'm going to have you go ahead and sit down and lay back for me. Now we're going to check the hips and the pelvis. So let's do knee to chest. Perfect. And down. And then pull your leg straight up for me. And then rotate your knee in. Perfect. And out. All right. And down. And then push against my hands. Perfect. Strength is 5 out of 5 there. Full range of motion in the hips and pelvis. And I believe that is it. We are done. Thank you, Janet.
Thank you.